It became very clear that the broad community sentiment was that this was to be treated as a health issue and a health crisis. So there did seem to be a disjuncture between the formal submission of what we received from the agency of the provincial government, recognizing this is a provincial initiative. Council certainly shared the sentiment that this is a health crisis, and yet the health service provider had indicated that they were not looking at providing the service. And so I think that that was the challenge that Council was grappling with when we're being told potentially differential messages from the provincial government. There was very strong consensus on Council that Turning Point is likely the best qualified and the strongest prospect for an agency to deliver the service, because they certainly are the agency that has the established relationships with the population that needs to be served. Council's deliberations, of course, only focus on land use and planning rationale. So even though Council opted and recognized and did not approve the existing Turning Point location as the permanent site through land use, that does not preclude Turning Point as an agency from potentially operating a mobile unit or from partnering with Alberta Health Services in exercising the discretionary option on the hospital site. Council was very methodical in walking through from a land use and public zoning planning perspective for where the prospective locations could be. And I think Council separated that issue from the broader and systemic infrastructure deficits that we're experiencing in Red Deer for health services. Having said that, so I think in rendering the decision, I think it was linked very strongly to land use and recognizing that the hospital really is our predominant health districting in the city. Having said that, I think it does highlight that the systemic provincial infrastructure deficit that we do have in Red Deer, recognizing that the health and lives of all Red Deerians and all Albertans in the Central Zone matter. And this is yet one more example of the need to close the service inequity that currently exists at our local hospital.
If turning points weren't there and it's bare land, would this be an appropriate use for the proposed services? And at the end of the day, Council said no. And it's because of the need to balance, to weigh and balance the needs of this vulnerable portion of our community who's battling the opioid addiction and other problems, and the needs of our residents and our businesses who work and play and live in the downtown and who are entitled to a safe, healthy, vibrant downtown community. The fact that Turning Points has relationships with these vulnerable people, they would be the key, the ideal service provider to go and set up, for example, an ATCO trailer, like is at the Sheldon Schumer Center. That can be done very quickly, and those same people who are currently working with the vulnerable at Turning Point downtown could be working with them at the trailer on the site that was approved at the hospital, and they're even closer to the hospital to avail themselves of the emergency services and some of the other wraparound services that are needed along the continuum of wellness.
It has been frustrating over the last 10-15 years how the province seems to drive by our community, not recognizing that we are representing over 453,000 Central Albertans. And as Red Deer being the hub, we must provide those services not only for Red Deer, but also for some of the communities. So it is frustrating, and I hope we're on their list and we have their attention now. If this truly is a health issue, if families and individuals are seeking supports, for me, let us look to the creativity of our community. I look to seeing what other cities have done. They have sites in their hospitals, the Royal Alec in Edmonton, for instance. And we have the Sheldon Schumer trailer. It's a temporary measure, so perhaps we also can look at that. But again, I don't want to jump to the conclusions, but creativity and solutions is what I hope comes out in the next few months.
I think we could have addressed most of the concerns that people had, particularly our colleagues in the business community, whom I very, very much empathize with. I think we could have addressed those concerns around the development permit stage. I think we could have done good work there. So obviously I'm disappointed that Turning Point did not get their site approval. But I'm certainly humbled and instructed and educated by my council colleagues, and I respect the decision that was made.